brief update. Fellow Kenyans, the COVID-19 disease remains a serious threat to the well-being of our people and the country at large. Our fight against it has achieved results, but we are still not out of the woods yet. The stage where we are in this fight requires that we remain focused and united, because this battle will be drawn out. The behavior and attitude by a few of our people suggests the opposite. There are those of us who, for reasons only known to themselves, do not want to obey the containment measures. If you wait to be affected for you to observe the measures, it might just be a little too late. Remember that observing these measures is to protect yourself and the people that you care for. We rolled out various interventions in combating this pandemic. Among the responses included the targeted testing carried out in several parts of the country. This targeted testing has been absolutely necessary to identify where the virus is for appropriate interventions to be deployed. Since we started this activity of targeted testing, the high numbers that we have tested have also resulted in unearthing large numbers in particular areas that have helped us identify and isolate various epicenters and deploy appropriate containment measures. As we mentioned earlier, the targeted testing confirmed that the virus is firmly established within our community. The numbers we have been witnessing from targeted testing attest to this and shows that none of us is safe from contracting the virus. If you remember, we now have the virus firmly confirmed in at least 34 counties, I believe. And it will not be long before we will be able to confirm this in each and every one of our counties. So it is spreading. It's already widely spread in the country, in the community, and very soon it will be found almost in every county. We therefore need each other to defeat this disease by collectively adhering to the containment measures. I know that we have gone through these measures many times before, and at the risk of sounding boring and repetitive, we will continue to do that. We shall not tire to remind you about them. Boring as we may sound, these measures are the only weapons we have to deploy against the disease. Hand washing, sanitizing where possible, maintaining social and physical distance, wearing of masks, avoiding gatherings, and staying home when possible. These are things that must become part of our daily lifestyles. The containment measures need to be complemented with a changed health lifestyle, which includes eating balanced foods, exercising, and avoiding situations that would lead to mental stress, among others. Eating healthy, getting enough sleep, and exercising is not only key to fight this disease, but is also critical for one's overall wellness. I want to reiterate on the protocols that we issued for truck drivers. The protocols are very elaborate on what is expected of each and every driver as pertains to COVID-19 test. The drivers are expected to undertake a COVID-19 test 48 hours before departing from their point of origin. And they should only travel once they have this certificate in hand. Proceed on then to their journey to cross the various borders. This is important because we do not want to create congestion and a backlog of truck drivers at the points of entry or exit into the country. Unfortunately, we have had to contend with this, particularly at our borders with Uganda. But in order to be able to streamline the movement of these trucks, it's important that this protocol is enforced and observed by truck drivers, by those logistic companies that are moving goods across. Please ensure that your drivers do not depart on their journey within the region before they have obtained a COVID-19 free certificate from their point of origin. Most of these trucks that are carrying cargo for the region originate from the gateway of Mombasa port. And we have testing facilities within Mombasa, in Miritini, at the Coast General Hospital, and other facilities therein which have been described within the protocol. Truck drivers should appear at those facilities 48 hours before their journey, have their samples taken, they will be tested, and hopefully within 24 hours those test results will be returned and a certificate, COVID-free 19 certificate issued, after which the driver then embarks on his journey, because that way that driver will be able to move very quickly across the border without any interruptions. It's unfortunate that some of our truck drivers are not following these protocols and rules, thereby creating a big problem at the border crossing points and causing unnecessary congestion. I want to appeal to them to pay attention to the guidelines, and if they fail to do this, then they will create a problem of congestion at the ports, but they will also create a problem for themselves because they will be held back at all those points for quite a number of days. And we don't want that to happen. Fellow Kenyans, let me now give you the COVID-19 situation as of today. Over the past 24 hours, we have tested 2,892 samples, of which 72 tested positive for coronavirus. This now brings the total number of positive cases to 2,093, while the total number of samples tested so far is 82,946. If we break down the distribution of these 72 positive cases by county, the picture is as follows. Nairobi at 39 cases, Busia 13 cases, Mombasa 8 cases, Kajiado 4 cases, Migori 3 cases, Kiambu 2 cases, Garissa 2 cases, and Kisumu 1 case. The cases are distributed in the sub-counties as follows. The 39 cases in Nairobi are from Kibra 16, Embakasi South 8, Ruaraka 5, Westlands 5, Langata 2, Embakasi West, Starehe, and Dagoretti North 1 each. In Mombasa, the 8 cases are from Mvita 2, Changamwe 2, Kisauni 2, and Likoni and Nyali 1 each. The 4 cases in Kajiado are from Namanga Border Point 3 and Kitengela 1. In Migori, all the 3 cases are from Isabania Border Point, while the 2 cases in Kiambu are from Githunguri. In Garissa, the 2 cases are from Garissa town, while in Kisumu the one case is from Kisumu Central. In terms of gender distribution, 50 of these 72 cases are male and 22 are female. Age-wise, the youngest is 11 years old and the oldest is 73 years old. Today, and it is always something to delight in when you have a recovery, we are delighted to inform you that 17 patients have been discharged from our various hospitals. This now brings to 499 the total number of those who have so far recovered from the disease. We thank God and our healthcare workers for this great achievement. The other side of the coin, of course, is when we have a death. And today we are sad to note that we have lost another 2 patients to the disease, bringing our total number of fatalities to 71. Our heartfelt condolences go to the family and friends of these 2 patients. Finally, we continue to appreciate the good work that our healthcare workers of all cadres across the country continue to do under very difficult conditions and circumstances. We can only pray to God to continue blessing them as they offer critical health services to our people. Thank you.